Hello, and thank you for choosing Jack Houston Memorial Hospital for your hip replacement surgery. It is important to be as fit as possible before undergoing a total hip replacement. This will make your recovery much faster and easier. The orthopedic surgeons at Jack Houston Memorial Hospital recommend an exercise program before surgery. Regaining the strength and movement in your hip before surgery will improve your recovery after a total hip replacement. In the weeks leading up to surgery, performing daily exercises that strengthen the muscles surrounding your hip is vital. The stronger and more flexible your muscles are, the easier it will be to bounce back and enjoy a happy, active life. The low-impact exercises in the following presentation will reduce fatigue, muscle soreness, swelling, and the risk of blood clots. The following exercises should be done now and continue until your surgery. You should be able to do them in 15 to 20 minutes, and it is recommended that you do the exercises at least twice each day. Do not do any exercises that are too painful. You may have discovered that you've been less active because of your hip joint discomfort. When muscles aren't used, they become weak and don't perform well in supporting and moving your body. An exercise program before surgery will help get you back on your feet faster. Many patients with arthritis of the hip avoid using their painful leg. Muscles become weaker, making recovery slower and more difficult. For this reason, it is very important to begin an exercise program before surgery to optimize your strength and flexibility. This will make recovery faster and easier. If you want to improve the odds of a successful outcome, getting in shape before your surgery will help. Muscle strength training is an exercise therapy program that starts before surgery. There are several advantages of performing muscle strengthening exercises prior to hip replacement surgery. 3 of these advantages include decreased post-operative pain, decreased recovery time, and improved overall outcomes. Having your hip replacement surgery will correct the joint problem, but you will need a regular exercise program to strengthen your muscles and properly support your new joint. Beginning an exercise program before your surgery can greatly enhance your recovery period. Make sure to do the exercises on both sides to build strength. Because everyone responds to exercise differently, you need to be the judge of how much exercise you can do each day. If an exercise causes an increase in joint discomfort, stop doing that exercise. It is important to strengthen your entire body, not just your legs, before surgery. You can strengthen your arms by doing exercises such as chair push-ups, because you will be relying on your arms when walking with a walker or crutches, getting in and out of bed, and chairs, and on and off the toilet. Light endurance activities, such as walking or riding a stationary bicycle, will help train your heart and lungs prior to surgery. The following slides present some basic exercises for you to perform prior to your hip surgery. You should plan on doing them for 15 to 20 minutes twice daily prior to surgery. Perform these exercises on both legs. The strength and flexibility you gain prior to surgery will improve your muscle memory and make for a smoother recovery. Now, let's take a look at pre-operative muscle strengthening exercises that you can perform before your hip replacement surgery to make your recovery much faster and easier. Ankle pumps. This exercise will help you increase your ankle flexibility, strengthen your calf muscles, and improve blood circulation in your legs. Strengthening the muscles in your lower leg will help support your hip as you recover. Begin by lying on your back with your legs extended. Support the affected leg with a folded towel or pillow under your ankle. Engage your calf muscles and move your toes towards your shin. Hold for 5 seconds. Move your toes away from your shin and hold for 5 seconds. Perform one set of 10 repetitions 3 times a day. Now, pause this video and practice ankle pumps. Gluteal sets or bottom squeezes. Gluteal sets will increase circulation and strengthen the muscles of your buttocks, which you use when walking and moving. This is an exercise that engages your muscles without moving your hip or knee. Begin by lying on your back with your legs extended. Squeeze your buttocks together. Hold for 5 seconds. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice gluteal sets. Quad sets. This exercise helps build the quadriceps muscle that attaches to the knee. Lie on your back. Tighten the muscles in the front of your thigh by pushing the back of your knee down towards the floor or bed. Hold for 5 seconds and then release. Perform up to 3 sets of 5 to 20 repetitions. Now pause the video and practice quad sets. Hip abduction. Weak hip abductors can negatively affect your posture and walking gait, so hip abductions target these muscles to strengthen them and stabilize your legs and pelvis. Begin by lying on your back and keep your knees straight. Slide your leg out to the side, away from your body, then back to the starting position. Do not allow your leg to cross the midline of your body. Make sure your feet are always pointed up. Do not let your leg roll in or out while sliding it. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice hip abduction. Heel slides. Heel slides are an important component of your recovery because they stimulate both your quadriceps and hamstring to improve range of motion in your knee and hip. Begin by lying on your back with your legs extended. Slide your heel toward your buttock so that your knee and hip bend. Hold for 10 seconds. Slide your heel back so that your leg is flat. Keep the opposite leg flat. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice heel slides. Short arc quads. Short arc quads take your quadriceps muscle through a short motion to develop and strengthen this important muscle, improving range of motion in your hip and knee. The quadriceps are important after total hip replacement because the knee and the muscles that support the knee help support your hip. Begin this exercise by lying on your back with your legs extended in bed. Support your affected leg with a pillow to keep your knee bent at 45 degrees. Straighten your affected leg at the knee by lifting only your heel off the bed. Hold for 5 seconds. Lower your leg back to resting position. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice short arc quads. Long arc quad or knee extension. Active knee extension increases your knee flexibility, range of motion, and improves quadriceps strength. Begin this exercise by sitting upright in a firm chair. Raise your heel forward until your knee is straight. Hold for 5 seconds. Slowly lower and bend your knee as far as you can. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice long arc quads or knee extension. Standing hip and knee flexion. Standing hip and knee flexion is an exercise that helps lubricate your hip joint and stabilizes your hip muscles. Stabilizing and strengthening your hip muscles is important in preventing further injury to your hip and providing stability in your knee and ankle. Begin this exercise by holding onto a chair. March in place. Do not bring your knees above 90 degrees. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice standing hip and knee flexion. Squats. It is important to have proper technique when performing squats following total joint replacement. This exercise engages all the major muscle groups in your legs, especially your quadriceps, gluteus, and hip abductors, which helps strengthen your hips and knees. Begin this exercise by holding onto a chair. Bend your knees halfway. Hold for 5 seconds. Straighten your knees to your starting position. Perform one set of 10 repetitions 3 times a day. Now pause the video and practice your squats. Armchair push-ups. This exercise will help strengthen your arms for walking with crutches or a walker. Begin this exercise by sitting in an armchair. Place your hands on the armrests. Straighten your arms, raising your bottom up off the chair seat if possible. Your feet should be flat on the floor. Repeat 20 times. Now pause the video and practice armchair push-ups. Doing the exercises in this presentation will help you recover after total hip replacement surgery. Perform the selected exercises as they are demonstrated. Do the best you can without getting to the point of severe pain. And remember, practice makes perfect. Thank you for viewing this presentation on preoperative muscle strength training prior to hip replacement surgery. If you have any questions, please contact our nurse navigator. And once again, thank you for choosing Jack Houston Memorial Hospital for your hip replacement surgery, where excellence is always our goal.